In our efforts to resolve the propensity of our patients resorting to hiking of their shoulder or the shrugging of the shoulder, we have created two segments to help you along this path of rehabilitation. In a previous video, we did a section on neuromuscular reeducation, and you can find that link at the end of this segment. And on this particular segment, we're going to talk about the biomechanics to integrate that intact and active rotator cuff, and essentially trying to promote that message that it becomes a natural contribution to the elevation of their arm versus the compensatory or substitutions of the deltoid and upper trap. And so with the UE Ranger, if a person is able to elevate their arm somewhere in the lower ranges prior to them resorting to the shrug or losing their strength and endurance, the UE Ranger offers the capacity to load the joint prior to elevating, and because of that, the joint is more stable dynamically and such that they can produce a short arc motion along that arc that they have necessity of strengthening. So you want to work high repetitions of appropriate motor activity. It also offers the capacity to integrate the external rotators prior to the act of reaching, and so that we can confidently involve the entire rotator cuff in the task of reaching. And as the patient progresses, you can execute just a higher motion. The other benefit of this setup is that the involved lower extremity can be utilized in the task of reaching with the whole kinetic chain. And a person can also begin exploring various variations of motion, all with the confidence that you're promoting appropriate motor activity versus promoting the strengthening of pathomechanics. And as a person approaches a level of fatigue, just simply move them back down and finish with just an easy arc of motion that they can feel relaxed as they begin, or excuse me, as they end their exercise. All the way down to back on the floor. And you've had just a very therapeutic influence on the joint, not promoting of substitutions, and confidence that you're executing healthy mechanics going forward.
We invite you to visit our website at ueranger.com, where you can find further resources to support using the UE Ranger with your patients. You'll be able to download a clinical manual and home exercise program, as well as view the supporting research and testimonials of both professionals and patients. We'd be happy to answer any questions you might have or discuss in more detail the features of the UE Ranger Movement Health System. Please call us at 402-210-8406 or email us at rehabinnovations@cox.net. We look forward to showing you how powerful the UE Ranger can be for your patients and your practice.